Welcome back to Hardball. President Obama has nominated Kansas Governor Kathleen Sebelius to be his Health and Human Services Secretary today. Governor Sebelius is a two-term Democratic governor in a Republican state and has never lost an election. Prior to serving as governor, she worked as the state's and was elected as the state's insurance commissioner for 8 years. She was an early supporter of President Obama's campaign, endorsing him a week before Super Tuesday. She was considered at the time a dark horse for vice president alongside President Obama. The daughter of a former Democratic governor of Ohio and the daughter-in-law of a former Republican congressman, Governor Sebelius is considered skilled at working across the aisle. But when it comes to health care policy, her efforts have largely been met with frustration. She failed to persuade state lawmakers to raise tobacco taxes for an expansion of health care coverage in the state, and she lost this fight for statewide indoor smoking. Governor Sebelius is a Roman Catholic, also known for clashing with abortion opponents in her state. She's a staunch supporter of abortion rights and has drawn fire from anti-abortion activists out in Kansas. So can she lead? Can she get the president's campaign for health care to succeed this year? Governor Jennifer Granholm is with us right now. She's the Democratic governor of Michigan. Governor Granholm, this is one of the toughest fights. Harry Truman couldn't do it. Ted Kennedy couldn't do it all these years. Senator Clinton couldn't. Hillary Clinton couldn't do it, and she worked the hardest to do it. How can Kathleen Sebelius win on health care, universal coverage?
Chris, the stars are aligned, and if anybody can do it, she can. I mean, she was named as one of the 5 most effective governors in the country by Time magazine. She's known for reaching across the aisle. You know, you talked about her bipartisan experience. I mean, she's appointed Republicans to run with her as lieutenant governors for her 2 terms. So she knows the importance of reaching across the aisle, but she also knows that this year is the year where the Chamber of Commerce and labor organizations and health care and everyday citizens are demanding that this be a part of our economic recovery. So I'm excited to see that that he has selected somebody who's so effective to be able to lead this.
We've heard the liberal case for health care. People who work hard and catch the bus in the morning and work every day don't get health care. I'm with them. There's another case. It's the business case. Tell us about the auto industry. I've heard this argument. You are the expert. How much does it cost for each American-made car in terms of health care that we're paying right now?
It's between $1,200 and $1,500 in every vehicle. And, Chris, I can tell you that last year, for the first time, more cars were built in Ontario than in Michigan. Ontario. And believe me, those automakers were not going there because of taxes. They weren't going there because of regulation. They were going there because of health care. This has become not just a moral issue. The moral issue is very important, but it's become an economic issue. And this is why the National Chamber of Commerce is all over this. We had the head of Walmart come talk to the National Governors Association, Lee Scott, and say we need a uniquely American solution to the cost of health care because it is driving us underground. It is making the cost of doing business in this country too competitive when you compare with what other countries are able to provide to their companies.
Why will it be cheaper for health care per worker, per car produced if it's done through a national system rather than through a UAW contract?
I think it's going to be what it's going to be is a shared responsibility. You're going to have personal responsibility, but you're also going to see more investment in primary care and in prevention, in healthcare IT, which will drive the cost of healthcare down. There will be a shared responsibility. So individuals may have to contribute depending on their income level. You'll see business contribute and government contribute. It won't just be a single payer system probably, although certainly they're going to go around the country and listen to what people have to say. But the bottom line is we need a uniquely American solution, and I think Kathleen Sebelius is the perfect choice to make that happen.
Well, let's talk Turkey here. Let's talk politics. You had Tom Dasher was knocked out because of a tax embarrassment, a big one, over 6 figures. And now you've got Kathleen Sebelius. Her dad was governor of Ohio. I know her a bit socially, very little. I know that her father-in-law is a Republican congressman. She's a pol. What do you know about her as a politician that would suggest she knows how to get this thing jammed through by, well, in some reasonable amount of time?
Well, she certainly knows that you need to listen to people and you need to understand how important it is to include all perspectives, that you're not going to get everything you want. And she's been an expert at that in Kansas. Certainly she hasn't gotten everything she's wanted as a Democratic governor with a Republican state, but she's gotten an awful lot done, and that's why she has so much respect. She knows this area. She knows health care. She came as the insurance commissioner, and she certainly will have the backing of the president, which is obviously very important. She's got a lot of respect among governors, and the governors want to be partners in making this happen. The National Governors Association has already appointed a bipartisan task force of Democrats and Republicans to help inform and work with the Obama administration on shaping this health care policy. So I think that if ever before, especially because of the crisis, this is the time to get it done, and I think she's really the one to bring it on.
Okay, thank you very much, Governor Jennifer Granholm. In today, pushing the case for Governor Kathleen Sebelius for HHS Secretary. That's going to be one hot set of hearings out there on Capitol Hill.